were so sad and depressed.
अरे बूंदा, मुझे तो लगा था कि अब तक 12 का सिलेबस कंप्लीट हो जाएगा, पर अभी तक नहीं।
As I know, you guys used to be toppers in 10th standard.
जब हमने बायो की फील्ड चूज की थी तो हमको लग रहा था कि सब कुछ स्मूथली चला जाएगा, लेकिन जैसे जैसे सिलेबस आगे बढ़ रहा है हमको लग रहा है कि सब कुछ कॉम्प्लिकेट होता जा रहा है।
मुझे तो पूछो ही मत, मेरा तो सब सर के ऊपर से जा रहा है।
Yeah, then we still have time, see. And today, that's why we have called Dr. Parul Vadgama. She is a shining star of her field. Apart from that, she's the head of TB and chest department in Government Medical College of Surat. She has been a past president of Indian Medical Council Association. She has conducted more than 20 national and state level of research programs in the field of tuberculosis, which is also known as TB. And she's also been active socialist. She works as a woman empowerment because she is an ideal for a lot of women. She encourages a lot of people to work hard every single day. She is even someone who helped me to overcome this, and I think she is the one who can help us out because we have a lot of stress because of her syllabus in 12th standard, and she is one who has gone through all the things. So I think nobody can best suggest us than someone who is already there. So ma'am, my first question from you is that as a youth, my question is that as today's youth today, that is in youth of India is confident or confused?
Right. I would say the youth of India is definitely confident. I don't see things pessimistic. Maybe you all feel depressed or not confident. It is a phasic thing. See, we all know that 12th standard or 11th standard is definitely it is having lot of course, lot of stress, lot of challenges about time management. But what I suggest to the today's youth who are feeling less confident is that first is that very clearly decide your target, what you want by what time. Right? Sometimes we have so many targets, so many ambitions that we don't know that what target you want to achieve when. So first of all, a time-bound target which is comparatively possible. If I decide that I want to become the master of degree of this doctor in 3 years, it is not possible. So we have to decide the target. Similarly, if you are in 12th standard, you should know what is your target. Second thing is that you should have a proper guide or who will teach you, or I would say a teacher or a mentor, right? The right choice of a mentor is also very important. Third thing is that you should have a proper time management. Many of us, I would say, we give time to the things which are less of priority. So what is your priority at which time is also very important. Being a doctor, being a professor, if I think that my patient is very serious and I am looking to some other patient who is not serious, so I will definitely lose that patient. So what is your topmost priority of the day, of the month and of the year? That should be very clear. Fourth thing is that when you are working for that subject, according to time you are working, with the mentor you are working, you should definitely discuss or targetize yourself that how much target you want to achieve. It may not be 100%. It may be between 95 to 100%, 90 to 95%, and then always develop a method of analyzing that why you failed. It's nothing a last stop. No bus is a last stop. You have to continue on analyzing where you can improve, what time, whether you gave less time, whether you didn't understand your subject, or whether you have so many complications together, or whether you have some health problem, whether you have some sleep problem, whether you have some health problem, or you have some mood problem. And if you have serious mood problems, I would definitely suggest you to go to a psychiatrist and don't be ashamed of. Many of us are ashamed of consulting a psychiatrist, taking help of a psychiatrist. This is not wrong. This is not to be ashamed of. It is very important, and to be very frank, in many countries, the young generation is, having depression because of the stress and because of other ambitions. 30 to 40% are in depression. So in such cases, I would suggest to students that in spite of all the things, if you don't find a answer to your depression or your mood swings, you should definitely consult a psychiatrist, and you should follow the treatment, and you should have at least 6 hours sleep. Maintain at least 6 hours sleep, a good hydration, and a good food. And I would suggest, even if you are in 12th standard, at least do exercise for 20 minutes a day. That will increase your hormones, increase your serotonin, increase your happy hormones. Exercise gives you some happy hormones. So 20 minutes exercise a day, even in the 12th standard, even on the previous day of exam, will definitely give you a happy hormone, and that is going to lift your mood and also increase your memory.
And as you say, like, it was something all know that, but exercise is like, we always sacrifice a lot of things. Like,
Yes.
I have exam, I should not watch this, I should not do this, I should not do this. And I guess following your schedule is one of the most important things.
Yeah.
I was really convinced with this that we should do exercise.
How can the youth contribute to the nation's economy?
Yes, very good question. I think youth has that much of power, a vision, I would say, and a lot of ambition and encouragement, or I would say motivation, to serve the nation in different aspects. If I talk of the youth of today's era, youth have so much of ideas, innovations, I would say, innovation in the business, digitalized business, business modification. I have seen so many youth who are working in their own father's factory, but they have actually modified the way of working. So youth, because of the knowledge and because of the digitalization, increased use of media, I would say, and change in the pattern of management, and of course a different vision, they can definitely bring change into all the businesses which are existing in the India. And of course I see youth as a bringing up new innovative businesses also, innovative engineering models also, I would say a researcher also in the medical or in the other field. So that I see youth as a skill based person, because now in national education policy we have a skill based programs also. We are motivating skill based work. It is not only about theory reading, but if you have skills, you can definitely do a business and earn the money. So I would say the youth is not just about doing a job or a government job. Youth is something like doing his own innovation and his own business, or developing his own skill, or marketing his own made technology. Or I see youth as a lot of youth into the IT department, information technology. I see youth, lot of youth in marketing. Even marketing, can grow, give you very good growth. Of course, computer and digitalization are the one of the mode where the youth can definitely earn money. So I think youth has no doubt the business is not changing, but the way of doing business, the way of promoting business, the way of managing business is definitely changing. And everything now, the government jobs are also online, the government work is also online, everything is now online. So everything is changing so that we can do faster work in small time, a particular work in small time, and that is definitely going to give a way to the economy. And I think that any youth, whether he gets any job or not, he himself can search out the ways how he can do a business, a good business that is possible. So I see youth as a very, very dynamic, very, very changing, and very, very accepting the changes very fast. And of course digitalization is one of the important factor how youth can earn more money. You have seen many videos, people are making the Twitter videos, the small reels you call.
Yes.
The young generation calls it reels, right? Or reels, in reels also they earn million of money, and that is also one way of making money. I would not say it wrong, it's wrong. Why not wrong? Means why not? Yes, you can definitely make good videos, you can make some educational videos, you can make some cooking videos. So there are so many ways of earning money, and the youth just has to accept or create a new idea that how I can earn money. That is what I see.
Ma'am, I want to know that as a medical student, what challenges we will face in the next 7 years and how can we cope up with all these problems?
Yes, a very important question. As a medical student, we have almost 3 to 4 challenges. The first challenge is that there is increase in the violence on doctors. Violence because of the maybe decreased trust of the patients and the relatives. Distrust is one of the reason for violence, which many a times it is wrong. Whenever any patient goes to doctor and gets his treatment, it is implied that the patient has trust on the doctors. But it is very sad that many patients and their relatives, if they lose their patient or if their patient is not doing well, though the patient has come in very serious condition, still the doctor is treating. But if they lose their patient, they create violence in the hospital, they hit the sisters, they hit the doctors, they kill the doctors. That have been also the incidences. So it is because the medical field is in now Consumer Protection Act. So we have, means our Indian Medical Association and all the professional bodies have written to the government of India that we should have some Central Violence Act, so that whether your patient survives or no. See, there are so many ways to complain for a doctor. I don't say that all doctors are very good. I don't say that. But no doctor would like to kill their patient. So if the grievances are there by the patient and the relatives, it should be dealt with by the police or it should be complained to the councils. But the way of hitting doctors and sister is really condemned and it should not happen. The second challenge which the medical students are facing, that they have to give now lot of exams. If I think of MBBS, they are giving 5 years exam to the university, then internship, then after internship now the next is coming up, right? Next is coming up, next one and next two. Then they have, so because of that they are very busy in the internship by reading MCQ exams, and the internship meaning is to do practical work. So they have to simultaneously read also, do the practical work. Now government is going to introduce next 2 exams also. So next 2 and next 1. After that they will have to give all India entrance PG also. So to get up admission in the postgraduate, they also again have to give an exam. For 5 exams plus next 1 plus next 2 and again all India entrance for PG. And after giving PG, it is not necessary that they will be clearing in that exam. Again, they have to work hard and give the entrance PG again. So almost 7 to 8 exams with so much of stress is actually a very big stress level in the age where they actually have to, settle down. At that time, they should start earning, they should marry, they should have kids. But that life of a doctor is going continuously in studies, and because of that, he is always stressed. So I would say that there should be, I personally believe that the certain number of exams should be reduced so that things can be smoothened out. So these are 1 or 2 challenges which I have talked, and there are others, but it is okay.
Thank you, ma'am, for your valuable advices.
Ma'am, as a student or as a youth, we have problems like anxiety, depression, friends influence, mobile phone addiction. How should we deal with this type of problems?
See, first of thing which you have rightly mentioned is peer pressure is one of the challenging aspect. Whosoever is a student, they will think, yes, what is my friend telling? What is my girlfriend telling? What is my boyfriend telling? See, that is to be avoided. I would say, you first decide what you want. You are an individual, okay? What is your wish? What is your ambition, or what is your target? Whether you like smoking or not, you like it or not, whether you like drinks or not, whether you like studies or not, whether you want to achieve first rank or not, whether you want to go by bike or not, or whether you want to go by car or not, it is your decision. It has to be your decision only, and never get affected by peer, because it is only the showmanship. what I have seen, that many students, they get together and talk about the third person, and the third person feels depressed that these are people are not involving me in the group. Actually, that group is not forever, right? ये पूरा ग्रुप आपका जो स्कूल का ग्रुप है या कॉलेज का, वो हमेशा नहीं रहने वाला. तो आपको अपनी आदतें, the habits which you create, all the things which you like, you have to decide yourself. If you think that you like a bike, you go by bike. If you think that you like a car, you go by car. If you can afford a car, then only you go by car. That means then if you don't afford a car, you don't go by car. So there should be nothing like ashamed of the my thing. You should be always proud of that what I have, right? If I am since long beginning, if I think that I have to study for 16 hours, I don't want to attend this function or my school function or my entertainment function, I will not go. If people talk about you, let them talk. It is their business. If you are talking about him, why he should bother that what you are talking? It is your business to talk. It is not his business to allow that talk to go to his mind. So I advise all the students, specifically all the students, that don't go by the words of your friends, your peers, your girlfriends, your boyfriend. You do whatever you like or you feel okay, or what is fitting into your society, your system, your family. And never you think that family ko kya pata chalta hai. Family is the only thing which is going to stay with you for the long time. So I don't say that don't you displease your friends, but the friends should not be create such a pressure on you that you change your habits, you change your thinking, you change your ambitions, or you change your mode of living. If I like to sit on this chair, I will sit on this chair. I don't need to sit on sofa. So it is up to us what level of involvement of your friends or your friend's statement you allow to go in your head. So everybody has to learn, not only in schools. Whenever you will grow up, in colleges, in your practice, in your field, in your competition, in your business, people are going to talk about you. So how much you want to take, that is your decision. It is nobody's else right also to disturb you. If you want to get disturbed, you will get disturbed. And if you don't want to get disturbed, nobody can disturb you. That is my understanding out of all these 20 years.
As you said like this, that this has been my experience. But when you were young, when everyone has a starting journey, like when we have hormonal changes in our body, when you come in that phase of life, when you choose every single thing. So how did you at that time reacted to highly stressful situations, or how you deal efficiently with the situations when you feel so stressed out and frustrated?
Yeah, I definitely had a incidence of my sadness. I was very much depressed, and I was thinking that I'm not able to do this. In my medical field journey. But then, gradually over the 6 months, I realized that overall, nobody is much worried about you. It is you only who are worried for you, or your family is worried for you. So gradually, I decided that what I want, that way I started by thinking. I changed my thinking, and that is how I coped up with my sadness. So it is not that everybody has everything in their life. That is also one important thing I want to communicate to the students. कि अगर मेरे पास कार है, मारुति है, तो ऐसा जरूरी नहीं है कि मेरे पास मर्सिडीज भी आएगी. Everybody of us has something special and has something which is not special. Today I have Mercedes, but I don't like it much. That is the situation. So आपके पास जब सारी चीजें आ जाती हैं या कोई फेज में आती हैं, तो कई बार वो चीज आपको अच्छी भी नहीं लगती. So I want to suggest the thing to the students. Specifically at this age, you feel that you don't have this, you have this as a minus point, or you have this as a minus point. But sometimes you don't consider what positive things you have, right? So you should always know your positive points, and you should always know your negative points. The points which you take it as negative, sometimes after 5 years, 10 years, you think that this is not a negative point. So don't waste your time in thinking that this is your sadness point, this is the thing which you don't have. You don't have a boyfriend, you don't have a girlfriend, you don't have a good car, you don't have a bike, your family is not well to do. Means there may be many points. Or he is not smoking, I am not smoking, I am not allowed to smoke, I am not allowed to eat non-veg. There are so many things. But the point which you take negative today may be converted to positive tomorrow. So just leave them. Positive points are enough to develop you, and you develop with those positive points, and negative points you should not think about it. Don't give space to your negative point. Just try to improve. If not possible, leave it. After maybe 5 years, 10 years, it will not have any value also. That is what I want to do.
Ma'am, if we try to improve ourselves, how did you motivate yourself to become an MD?
I motivated, it was actually a long term motivation. Since childhood, I wanted to become a doctor, and it was decided that I want to become a doctor. So, MD, I didn't decide, I at least decided for MBBS. And after that, I thought that I was definitely affected by peer. Everybody is doing MD, I should also do. So that sort of, but actually my marks were very good, so I got a MD admission. So this is an era where everybody was doing MD in 2003, and I also did. But for MBBS, it was a long-term motivation. It was my motivation. It was through my family, through in fact, my mother. She also encouraged me a lot, and I also saw that to serve to a society in a better way, or I would say in a vaster way. Doctor is one profession through which you can do your profession also, and you can serve the society also. If you have two things in your ambition, you are always successful. There are many doctors who are working as a profession and also doing social service. So I say to all my juniors and my friends also that select a profession where you are professionalist also, and you can partly serve to the society also. You can bring some change in the society also. So that gives you more happiness. If I earn money, rupees 5 lakh per month, and not doing any social service, I will not be happy. That is my nature. Maybe other doctors may be happy, but my ambition is to simultaneously serve to the society and spread some good positivity and some good social service. So that will give me happiness. So similarly, the thing which give me happiness, it may not give you, or it may not give you. But overall, I find the motivation of course, my family and myself also.
Ma'am, I have another question regarding to your medical journey. That when you had performed your first surgery,
Dissection.
yeah. So you were confident or a little bit nervous?
Of course, everybody will be nervous. it is a very different. You are cutting the skin of the patient and blood is popping out, and immediately one of my friend got shocked and he fall down. So it was a scenario. कि वो लड़का गिर गया, but then still you have to continue the surgery because you cannot just, you are on the patient, so you have to open, and it definitely gives some bad smell also when you perform a surgery. Bloody smell comes when you burn a tissue. You get a different smell. So it is, and you are almost close with the gown. So it is obviously not a very good atmosphere, but gradually you get used to it. But yes, it was not a very comfortable thing. I didn't fall, but of course I had a bad smell and bad aura was there. But it gradually settles down. That is what I am telling. That final ambition, what is your final target? You have to remember it daily, or you have to remember it 10 times a day. कि मुझे तो finally ये surgery करनी ही है, या finally ये बनना ही है. Then everything will be second. But if you think that no, this is a hurdle, this is a hurdle, this is a hurdle, then it's a hurdle.
Ma'am, there are various fields in our medical life. So, what aspects of the medical field you choose that is attracting you towards it?
I would say there are so many medical. See, first of all, there are 3 medical specialties. You all must know 4. I would say one is MBBS, one is BAMS, that is Ayurveda, then homeopathy, that is BHMS, and dentistry. Okay, these are the 4 broader lines of the medical. See, what I suggest, if you want to learn for allopathic medicines, you should go for MBBS. If you want to learn Ayurveda, you should definitely concentrate for Ayurveda, BMS. BHMS is homeopathy, and dentistry is related to dental, orofacial, maxillary surgeries and all those things. Now, if I talk about different specializations, like almost we have 23 specializations. So if I want to go for surgery, gynae, pediatrics, ENT, ophthalm, sort of different, if it is related to physician medicine, it is medicine like diabetes, hypertension, heart problems, all these is related to physician. Surgery is related to surgeon. Our deliveries and gynecological issues are related to gynecologist. Similarly, eye issues, we call it ophthalm. Sonography, X-ray, we call it radiologist. So there are different 23 branches. But I would suggest to a doctor that when you are selecting your super specialization after MBBS, it has to be selected after MBBS only, right? So in internship, you should go to all departments, 23 departments. You should work there. You are posted there. Internship is mandatory. So you will be able to know whether you like surgical line broadly or non-surgical line. Out of non-surgical line, you have 3-4 options. That medicine, pediatrics, right? Radiology, chest medicine. And in surgery, you have 3-4 options like surgery, gynecologist, orthopedics. Okay. So you have to first decide whether you like surgery or you don't like it. Second thing, you have to decide whether you want to be clinical or non-clinical. For example, there are non-clinical branches like paraclinical, like pathology, microbiology, where you have to work in laboratory only. And if you want to be with patient, that is known as clinical. Similarly, radiology, you have to work only in the center, like X-ray, doing X-ray, reporting X-ray. So in that, you don't have a patient contact. So things should be classified according to whether you want patient contact or not, or you want medicine or surgery, and basis on that you have to select your batch.
So what is the difficult in surgery section?
It's nothing like difficult. It is your choice. Like orthopedic.
So, like dealing with the body, there are some
I
parts
would
for
name your 2-3 girls also who are not now taking orthopedics. Previously, girls were not coming to surgery departments. It was only for the males, boys. But now girls are also doing surgery. Girls are doing orthopedic surgery also. As such, orthopedic surgery needs lot of strength, lot of muscular strength, lot of work, lot of challenge. But now girls are also doing. So surgeries are like I would say orthopedic surgery demands lot of care, attention.
Like which kind of muscular strength we need for?
Means you have to cut the joint, you have to joint the joint, sort of that things. So it needs a lot of power in the muscles. Inner power also and external muscular power also. But that is possible. See, now the girls are also doing orthopads. They are doing surgeries. Everything is okay. Like anybody can join anything. But overall things are very busy in all the MD and MS. You get lot of work, many patients. If you are in a government institute, you get too many patients. For one branch, we get 200, 300 patients a day. So that is a good number of patients. And I would say that if you are interested, you can do it. If you are not interested, you think that you medical, you don't want to go, you don't want to give 5 plus 2 plus 3 years till like 11 years you are just finished MD. Then you have to do super specialization also. Super specialization again you have to give entrance. So if you want to give your 12 to 13, 14 years to your career and you want to do continuous hard work, then only you should opt for the medical. Otherwise, there are so many good things in the society, so many good professions in the society where you can work. And the society needs everybody, not only doctors. Society needs good educationalists, good doctors, good CA, good engineers, right? Society needs everything. So don't feel that doctors are superior or others are inferior. It is not like that. Every field, if you are a master, you are needed. If you are not a master in medical also, you are not needed. So the how precisely you are doing your work, that will give you a credit rather than choosing a profession. I would say अगर आप छोटा सा एक इंस्ट्रूमेंट भी बना रहे हो और वो आप अकेले ही बना रहे हो और आप ही बेस्ट बना रहे हो तो आपकी वैल्यू है. So it is all a need based demand, or I would say it is need based importance of a person or a business.
Ma'am, I have another question.
Yeah.
How should we choose our medical college?
Yeah. Medical college, I would suggest that we have the list online also. But when you are going for the online list, you should definitely give first priority to the government medical colleges. Why? Because I don't say private are not good, but government medical colleges, most of them are very old. So there the patient load is very high, the clinical work is high, the clinical material is high, the teachers are senior. So you can get more knowledge, more patient experience, more seniority benefit, right, in those colleges. Otherwise, privates are also good. You should definitely see to it that how many teachers are there, what is the seniority of the teachers, how many departments are going on, how many departments are actually running. So you should look at all these things so that you will be able to decide. And how you have to also look at what is the total number of OPD in that hospital, how many patients are indoor in that hospital, whether that is going to be clinically sufficient for you or not, especially in MD. In MD or MS you are taking admission, you should see how many patients are there. If patients are not there, you will not learn more. So you have to see according to that whether the medical education is good or not, how many teachers are teaching, which departments, what is the attendance of those departments. Try to get the number of the seniors also who are there. So that way you can ask. So that way you can enter.
As you ma'am suggested a lot of things which are very related to us, especially to them. So my last question is that apart from our medical colleges, apart from that, as you are socialist, you empower everyone. So what's a good advice you would like to give us about our life and our students who are particularly our audience too?
I would say that life is a continuous journey. If you fail at one step, it does not mean that you have failed. It is part of your journey, and it is not just for saying. I also have failed in two things. Just I don't want to share the incidents, but I have failed in two things. But after that, I realized that how can I achieve this thing? What I have to work for this thing? What I have to, whom I have to contact for this thing? So there are ways of getting the things. Only one way may not be enough. You may have to apply multiple ways to reach up to that destination. So I would say life is a journey. One step failure does not mean that you have failed. You try again. You try in a better way. You get help from others. Don't be ashamed of getting help from others. कि मैं उसको क्यों पूछूं, मैं इसको क्यों बताऊं, ऐसा नहीं होना चाहिए. You should share your information with others and also try to get information from others. Try to get help or advice from others. And that is how you should carry on. Never stop. If I have failed in one thing, I will not stop my work next day कि हाँ मेरा तो ये fail हो गया, अब मैं कुछ काम नहीं करूँगी. ऐसा नहीं हो सकता. You have to continue working and that is how your life will go. And your target you should not never forget. If you have failed in one target, maintain your target. You will succeed second time, third time, fourth time. It is not like that. I have seen so many people who are working continuous for 5 years, and after 5 years they get PG admission. After 7 years they get PG admission. Why? Because they were persistent. So failure, I don't see it as a bad thing. Life has many failures. Success everybody is enjoying. Failure also you should try to analyze. उसको घर पे बैठ के 2 घंटा सोचो कि मैं क्यों फेल हुआ. Write down the points. Then after writing the prompts, where you can improve, who can help you to improve. And after that, again start working on that direction so that you reach your target next year or maybe 2 years, maybe 3 years. People are coming to us in MD admission after 7 years. I have seen so many doctors who were doing BSc, then tried for their entrance exams, and after 5 years of BSc, they came to medical. So it is not like that. Nothing is a barrier. if your intention is there, if you really want to work for that field, any field, though you should definitely go on, continue your efforts. That's it. Continue your efforts. Don't just sit down.
Your words were like influencing, because our boards are coming and there is a lot of pressure on everyone, like on teachers also, because their whole year's work, what they have given us, it just shows in one day results. So everybody is under the pressure, but still they always, like our principals, our supervisors and our teachers, every single day motivates us to do hard work. But sometimes there is one day in a week where we feel like नहीं आज नहीं करना है, आज नहीं पढ़ना है, I don't want to study today because we're frustrated. On that day come and they teach us, no, you can do a little bit of today, just don't waste your whole time. And that's always just keep us going. Even we're getting chance to like sitting over here with you and getting guidance from your experiences, because it's a huge thing. When you step in a new career, like after 12th, there is no safe walls. You don't have to go to school. You have to do everything by yourself. So we need guidance. Yes. And we are happy that we are studying in school where we get guidance not only of their experience, but in a vast variety. So you were really get to sit over here and to get your experience. So it was a fabulous experience for me. And I personally think that I never had this kind of talk.
Even I would like to congratulate the management and the principal of the Gajera school, and of course all the teachers who have planned this type of session, which will give some, I would say, encouragement, and of course one motivation, and also will help the students who are stressed or depressed to decide for their direction, or maybe they can give time for rethinking, right? If somebody is depressed today, they can again think that what should I do next day. And of course, as I said, it is a journey, so we should never stop. We may be plus or minus. See, everybody is plus minus, but at least maintain your journey so that you don't stop and you continue working. That should be the target. So I congratulate the entire team of Gajera School.
Thank you, ma'am, for joining us today. Thanks from all of my crew members and from Gajera, because we are very lucky to have you.
Thank you so much. Thank you all of you.